lot has changed in the 2 years since the start of the COVID pandemic. We now have new vaccines targeting the most problematic variants, and we have a much better understanding of the virus and its mutations. But heading into the winter months, local health officials say now is not the time to drop your guard. Joining us now is Dr. Kental Sheth. He's from Northwest Hospital. Good to see you.
Good to see you too.
I'm sure you heard the ripples of the headlines, the president saying we're not in the pandemic anymore. He walked it back a bit and says we're just not where we were. Explain to me where we are with COVID-19 right now.
So we're definitely much better off than we were
Sure.
when this pandemic started, right? We have vaccines, we have some treatment options. We definitely know a lot more about the disease. So, like they told us when we were kids, like knowing is half the battle.
Yeah.
And I think we've definitely gotten a lot of that information. We're not out of the woods. I think this winter will be a huge telling point to see where we really are.
Sure, I was online looking at, shot appointments for the new bivalent booster, and they're disappearing by the day, so I guess people are getting them. What are you noticing at the hospital? Does it feel like the momentum is still there?
So unfortunately, we're actually seeing like a lot of the momentum kind of wax a little bit at this point, because what we're really seeing is that the people who really want to get the shot, they're right there. And then I think a lot of people are still very hesitant. They feel like they've gotten the vaccine before, so why do they need to get this new vaccine? And it's actually extremely important. So, what we've seen is that our immunity does wane a little bit. This is going to provide you a lot more protection as soon as we get into those winter months to keep you from staying out of the hospital. The last thing you want to do is actually come and see me.
Yeah, right, exactly. You got that right. Who should be getting the shot right now? Should we be focused on the immunocompromised and older folks, or should everyone be getting the bivalent?
Everyone should be getting this new bivalent.
Okay.
So it's approved for everybody 12 and older. Anybody younger than 12, they probably have just gotten their boosters. But otherwise, anybody 12 and older should be getting the bivalent shot.
Take me inside the hospital right now. Does it feel like you're dealing with a different illness now? I mean, you think all the way back to the very beginning. We saw mortality rates. Just, people weren't surviving this right now. Now some folks just stay home and maybe Paxlovid ends up helping them out. What do you notice now?
Definitely. So in general, the fear factor that was there before has gone away, which I think is, a huge part of it. Everybody was just living in fear at home of the unknown. Now we know a lot more. And when a patient comes in with COVID, we're not scared as to, well, what are we going to do for this patient? We have kind of treatment protocols. We have actually very few patients that are COVID positive. And a lot of times the patients that are COVID positive, they're actually at the hospital for something completely different. Sure. COVID just happens to be another one of the diseases that they may have already had.
I've seen two different things that make me, sort of question what's going on. I've seen concerts of people shoulder to shoulder, no mask, and they're having a good time. I've gone by bus stops where kids got out of school and they're all wearing masks and they seem to be fine with it. What is the right thing? This has now become a personal decision, do you think?
I definitely think it's a personal decision.
Okay.
Well, I think, the mandates when we first had them and when we didn't know what was going on were completely appropriate. But at this point, there have been so many opportunities for people to get vaccinated. It's kind of at your own comfort level. The risk is never going to be zero, but it's kind of the same way that every time you step into a vehicle, there's always a risk that you take.
Yeah.
But it's a risk that, most people are willing to take. And I think we're kind of at that point with COVID, as long as we continue to maintain a lot of the things that we're doing now.
Does it sort of take on like the feeling that you have when it comes to a flu, where you have a different strain sort of as time goes on, so we'll see a different shot as time goes on? Is that how it works? It has to be formulated each year?
So we're going to have to see. As of right now, it seems to be heading on that trajectory.
Okay.
One of the things that could potentially happen is that over time, the coronavirus just may end up being like other coronaviruses, where it's not really as effective in terms of kind of causing a lot of the symptoms that it does now. And if that, completely goes away, then you really don't necessarily need to have a shot every single year. For the foreseeable future, I would say the next several years, there's a good chance that we probably will end up having a new vaccine pretty much every fall.
Yeah, and I was just, you sort of hit it. I've always thought that we get to the point where this is just something we live with. We live with the flu every year. Do we live with COVID every year? And that's a possibility.
I definitely think it is a possibility. It's just something to keep in the back of our mind. One of the things that we've always had is that some flu seasons are really not that bad, and then other flu seasons are much worse. And so that could be the same trajectory that COVID takes as well.
All right, Dr. Kental Sheth, good to see you, man.
Good to see you too.
Take care.